Hi and welcome to ThePrint. As COVID-19 cases peak, the print team and health experts will decode the causes, impact, and preparedness in India. Welcome to this new program called Virus Decode. In the last 8 days, India has reported a 6 times spike in COVID cases. At the same time, on Thursday, India reported a single day spike of over 90,000 fresh COVID cases with 325 deaths. The daily positivity rate also stood at over 6%. We have with us Dr. Subhash Salonke, who's COVID National Task Force member. Welcome, sir. We also have Dr. K.A. Reddy, who's also a member of the COVID National Task Force. And at the same time, we have our in-house expert and health editor, Abantika Ghosh. They will answer all your questions related to the COVID pandemic and at the same time, the new variant, Omicron. Welcome, all of you.
Thank you.
Yeah, I will start the first basic question that everyone is asking. Where is the pandemic headed? What can we expect in the coming few days? Dr. Salonke, if you could begin with that.
Yeah, I presume and based upon what is the situation globally and also within our country, it is quite evident that we are on the on the initial phase of the third wave. It is quite possible that this entire third wave is likely to take few months, definitely more than few weeks, definitely. And we are on an upward arm of the rising curve. And whatever the number that we are witnessing today, 90,000 cases in a day, is going to grow. That is definite. And under the circumstances, the fact remains that the preparedness, which is already launched throughout the country by various states, is going to put to the test very soon, literally in just few days. So we are at a stage where we are going to see more and more cases. We are at a stage where it is going to have a direct impact on even economy because restrictions of the movements and restrictions are being imposed by all the states. And even though lockdown is not being discussed at this stage, who knows, it could be, and if situation gets worse, it can also be resorted to, but the situation is getting grimmer day by day. That is what the present situation or anticipation of the pandemic in India is concerned.
Dr. Reddy, we have been talking about numbers. What can we say? I mean, today, if I am to ask you, what exactly can we expect in this month or the coming month? What would be the peak? What would you say?
Well, firstly, it depends upon the behavior of the virus variant. And secondly, depends on our response and our behavior as well. Now, in terms of Omicron, we know that it's a milder variant so far from global reports in terms of its virulence, but with much higher infectivity. We do know, however, that there is a fair amount of pre-existing immunity in India, partly because of the high exposure during the Delta wave, as well as the vaccination program. But nevertheless, we also know that past immunity doesn't protect against infection per se. It protects against severe disease, hospitalization, and death. So we are likely to see a large number of infected persons as cases, but not a large number of seriously ill persons as a fraction of those infected. Yeah. However, if the number of people infected is very high, obviously, even if the fraction is smaller, we will still have a challenge both to the health system and the social systems. Health system, we could still have our hospitals coming under pressure if we allow the numbers to mount very quickly, if we don't stretch out this wave, which we need to do. But also imagine if a large number of people in an office, whether they're performing essential functions or whatever, 50% of them fall ill in the same week, then you will find many of the operations of society coming to a standstill. Even in the highly vaccinated northeastern states of the United States of America, now you're finding that many of the essential functions are coming to almost a grinding halt because of a large number of people getting mildly infected, but having to isolate themselves at home. There are no bus drivers to drive the school children to the schools. So we have to look at both the health system challenges as well as the social challenges. And we are likely to see the cases rise. It is in our interest to stretch out this phase rather than let the cases peak simultaneously in a huge surge.
Abantika, you have been reporting on the COVID-19 pandemic closely. You have been writing about the preparedness of the government. I want to ask you, what kind of pressure you think this will put on our health infra, considering the infections are rising sharply?
Yeah, so I'll give you some numbers. All of these are numbers that were given out officially.
Right.
Some weeks back, two numbers, at different points of time. One was Dr. V.K. Paul, who's member Health Niti Aayog. He's chairman, co-chair of the vaccination committee, and he's a very important person in this COVID-19 fight back. So he said that if we see a surge like was happening this was about a month back, he said that if we see the kind of surge that is currently happening in the UK, we would see 14 lakh cases a day. He had also, at an earlier date, said that we are currently equipped to handle 4.5 to 5 lakh cases per day. That kind of surge, we are equipped to handle. Now, yesterday, when I asked him about this, he said the 4.5 to 5 lakh estimate was given with the hospitalization rates of Delta in mind. Delta was about 18 to 20%. Right now, we don't know all India figures of what kind of hospitalizations would happen because of Omicron. He gave us a Delhi figure of about 4%, Mumbai of about 5%. So obviously, we need a lot more India-specific data to even assess what kind of stress the health infrastructure is going to be in. I think, in fact, that's what the government also feels, that it's how the virus is going to behave in the Indian genotype. That is still a sort of an open question that will need some more weeks to answer. But I have to say this, and this is the most important thing. Mild or not, a very small fraction of a big number is still a big number.
Yes.
Our health infrastructure is, let's say, it's not the best in the world. I mean, it's got many limitations. We have been exposed time and again in the past. So let's not push this with this mild narrative, because also in a human system, all of us are different. Something that is mild for me may not be mild for the person next to me. So it's, I think we need to sort of really, all of us need to work towards not having a situation like the second wave.
Well, in the course of this live, we will be taking questions from our viewers.
Can I ask a question?
Yes, please.
So I have a question, Dr. Reddy, Dr. Sarunke, whoever would want to answer. If both of you do, that would also be great. We have set this benchmark of 5% positivity. And right now, our cities are seeing, Bombay is saying, Mumbai is saying 20%, Calcutta is saying 40%, huge positivity. And Omicron, as we know, is far more transmissible. So is it time that we revise this 5% benchmark, or does it simply mean that our cities are not testing enough and we need to test more?
Professor Reddy, please.
Well, it is true that our cities may not be testing enough. It's also true that a large number of people who are actually infected may not be getting themselves tested if they are getting only mild symptoms. And the other problem, of course, is you do not know what fraction is due to Omicron and what fraction is still due to Delta or other variants, because our genomic analysis numbers also have to be built up. But the key lesson for me is that the numbers are rising, whichever way they are counted. And if the test positivity rates are rising very fast, that is indicative of the fact that there is a considerable amount of spread. Now, the lesson that we should have learned from Delta, and which I hope we'll implement this time, is in the first wave, we managed to prevent a very rapid spread from urban areas to smaller towns and rural areas. In the second wave, we did not do that. With our local body elections, assembly elections, religious congregations, all kinds of rallies that being held at that time, sports festivals, whatever, enabled the smaller towns and the rural areas to be easily invaded by the virus. Can we at least learn that lesson and slow down the transmission into the smaller towns and rural areas of a virus that has already become active and highly active in the urban areas? That's going to be the big challenge this time.
Can I also come in, please? Yes. Actually, continuing what Professor Reddy has indicated, see, to put it in a little blunter fashion, we have really not learned the lesson on the second wave. The fact remains, all the factors that Professor Reddy has enumerated right now, they are in full swing. All the parties are having different kinds of congregations, election rallies, religious rallies, these rallies. We have not learned the lesson. Two, there is still a perception, or some people start feeling it is a disease which is in only Delhi, Mumbai, so metropolises. This is absolutely utter. I want to be a little more careful. It is not correct. The fact remains, the community transmission has got initiated in the cities, and it is bound to get now overflow towards the rural area. There is no mechanism that has been in place in any of the states that will prevent this. This is a ground reality. Third, because of the adverse impact on the economy, all governments are trying to put these restrictions or whatever it is to ensuring that the economic disastrous results are not encountered. Four, population right now is, we are swinging between panic and not bothering about totally. And these all four factors are clear recipe by which within next few weeks throughout India, irrespective of the state, it is bound to get, transmission is going to happen in both rural urban areas, and that is the foregone conclusion. Only one positive point, according to me, is that if we handle it in a way like primary healthcare, so every city, every rural area have a situation wherein home-based care monitored by the teams through the primary health center, through the primary health centers at the urban areas, and the proper monitoring is done on hourly, daily basis, still we will be able to tide over the crisis. If we leave it to the progress of the pandemic, we are heading for a very, very serious trouble. And last point I want to make, that even though Abantika said that the mildness of this particular variant need to be, we have to take it with a pinch of salt or a kilo of salt, but the fact remains that if we do not do that, there will be panic. So people, our population is a very peculiar one, and on one day they will say कि कुछ नहीं होता चलता है, and other day few people dying, then there will be total panic. We have seen remdesivir, the near right situation to get that particular drug. So I personally feel appropriate, realistic, data-based scientific information must be shared by Government of India through the media to everyone. That is the basic thing that needs to be worked it out. And last point I want to make, that the earlier, Professor Reddy will remember that earlier we had stated, please start third dose for the healthcare providers, frontline workers, ensure that the people with 60 with comorbidity are protected. This was known to us 1.5 months back. Now that we have finalized the date, 10th, doesn't matter. At least on 10th onwards, and again we start debating whether there's a cocktail or mixing of the vaccine, this, that. No way. जो available है वो शुरू कर दो, and quicker the better. I think if we do that kind of a multi-pronged interventions and attack, we will be in a comfortable situation without generating terrible panic. That is what my perception is.
Thank you, Doctor. As I said, during the course of this live, we will be taking questions from our viewers. So Suresh Kumar wants to know, is the third wave dangerous? Do you see a risk as doctors, paramedics, medic staff, and police are getting infected? Do we have sufficient vaccines? Do you think private hospitals should reserve at least 50% of beds for COVID? Dr. Reddy, if we can begin with you.
Firstly, I think we ought to really focus on improving our home care facilities. Ideally, if our primary healthcare system is very strong, then majority of the people could be treated very effectively at home with supportive supervision from the primary healthcare teams, and only a small fraction would need to be transferred to hospital if their condition became serious. Even during the second wave, in the district of Karnal, starting on May 24th, we had a program partially co-designed by the Public Health Foundation of India, but essentially a partnership between Deloitte and the government of Haryana, in which the model of home care by trained frontline health workers, supported by telehealth services offered by senior medical students of the medical college nearby, with emergency transport arrangements also made for the cases in case there would be deterioration. That worked exceedingly well. 87% of the people were treated actually at home very effectively, with a very sharp reduction in mortality compared even to the earlier wave. So it is possible to do it, but we need to focus on a very efficient home care system so that the hospitals don't get overwhelmed with cases that do not require hospitalization. But in terms of actually ensuring that we do not also allow our systems to get overwhelmed, we should spread out this wave rather than a huge surge of cases happening in just 1 or 2 weeks. If we can actually ensure that people are not getting infected in very large numbers at one time, then the systems can cope much better. But I believe we have learned some lessons from the second wave, and I hope they'll be implemented across the country. But we also know that different states have different levels of capability in their health systems. So we'll have to wait and see which states will perform well and have learned the lessons of the second wave, and which states are still lagging behind.
Dr. Salunke.
I think preparedness on the part of all the states or every state is going to be very critical at this juncture. Continuing what Professor Reddy has stated, the triaging, who are the people who need to be admitted in the hospital is going to play a very, very critical role. The beds are limited. The critical care beds are still further limited. So that particular section, which will require to be managed in ICU, which really require ventilation. So that discretion need to be based on the scientific data or scientific information, and that need to be worked it out at the city, at the district level, knowing fully well how many public hospitals are there, how many private hospitals are there, and as was done in Maharashtra, wherein 80% of the private hospital beds were reserved during wave 2, when there was a very serious issue. Same approach needs to be again taken up, and Maharashtra government has already gone ahead and indicated to all the divisional commissioners and collectors. So that will certainly ensure that people will not feel panicky, as we were discussing in the second wave, that if I'm at home and if I'm assured that if there is a need, I'm a patient having COVID, and I'm being managed by my team or myself, and the doctors are advising me. And if there is a need, ambulance will come at my doorstep in 15 minutes, and I'm going to get assured bed, whether it is whatever type of the bed, whether you require oxygenated or bed with ventilation facility. If that is assured to me, I will be comfortable at my home and not go on rushing. And that is the crux of the matter. If we ensure this, and that too, so district, sub-district, and cities will be a functioning units, and there's no need to take care of from Delhi or in Mumbai or any state headquarters. District and cities will play a very, very important role to reduce the mortality. That is going to be, otherwise it will result into a stampede, kind of a situation that we have seen that can happen. Definitely it can happen.
Mm-hmm. So just as we are talking, the Delhi numbers are in over 15% positivity, 15,000 cases. So it's galloping, basically, the numbers in Delhi.
that 5% business has gone. Forget about that 5%. I spoke to Honorable Deputy Chief Minister yesterday and the Health Minister of Maharashtra. I said, sir, the Commissioner, Mumbai Municipal Corporation said, no, we should put lockdown after 20,000 cases. I said, sir, already 20,000 are in Mumbai. You test more, you get more than 20,000.
Exactly.
So that number has lost the significance now. So under the circumstances, we have to keep in mind a dynamic situation and act accordingly. Basically, primary health care, ensuring home-based care, and those who require to be admitted must be admitted and managed. If these three strategies are done properly, we will definitely come out as a winner of this particular wave.
Well, one question that everyone seems to be asking, and I want to know from all three of you, Vipul Rathwa wants to know, is Omicron, is it really mild?
I think Professor Reddy is an expert in that field. I'm
what
an
do we
operational
mean by
person.
being mild? Yes.
Well, in terms of individual health effects, the number of people who are infected with Omicron, of them, how many develop very serious illness to get them into hospital, intensive care, or even kill them, in comparison with Delta or even with Alpha, the variants before, it does appear to be milder, and this is from across the world. However, we must recognize that it has also entered at a different period in time. It has entered when many people have acquired some immunity, at least from previous virus variants. Also, several people have been vaccinated. Unless we study the experience only in unvaccinated, uninfected people, we cannot directly have a proper comparison of virulence. However, from whatever evidence is available, it does appear to have lower virulence. But we should keep in mind that what may be variable virulence in a person is dependent also on the personal characteristics. If you're an elderly person, if you're immunodeficient, if you're malnourished, then it can still be very virulent in terms of the deadly consequences. Also, if we allow this to attack many people at the same time and our health system cannot cope with that, then again, many people who might not have otherwise suffered serious illness or death might do that. So biologically, yes, it appears to be milder, but in terms of epidemiology and health system challenge, it may not be such a mild virus.
One angle that we have to keep in mind at this juncture is, look at in Mumbai, 300 doctors are already infected. So the direct implications of such health system being affected or impacted is going to be, also, if there are no adequate number of healthcare providers, a comparatively milder case is likely to land in a complication, and if there are no adequate care that is being taken, the mortality might rise. So these factors also need to be kept in mind. But at the same time, as far as India is concerned, according to me, wherein 85% of us are either having infective immunity based upon natural infection or vaccine, we have done fairly good job as far as vaccination part is concerned, and combine these two very positive factors, there could be a situation wherein we really find that the mortality will not be that bad. I actually spoke to some of my colleagues in Mumbai and in Pune who are directly dealing with the patients yesterday itself, and they are coming across not a large number of critical cases, and their ICUs are not full. Even though we are at a very earlier stage, I agree with that. But at the same time, it appears to be we are in a comparatively not a very bad situation at this juncture, and they are also not feeling threatened. So overall, situation appears to be comparatively better.
But you mentioned that we knew that this was coming 1.5 months back, and already we have you also mentioned such a huge number of doctors and nurses across the country who have the infection, and they've basically been taken out of the workforce. I mean, serious or not is a different question. So are we a little late with this third dose?
See, individually, if you ask me, it is comparatively easy for me as an individual, as a public health person, saying that, well, do that. But if you are in Delhi looking after the entire country and to put these kinds of recommendation from us into an operation, there are a lot of preparatory steps need to be worked it out. Availability of vaccine, availability of the healthcare providers, which type of vaccine. I had clearly stated, do not bother about developing newer vaccines. Do that, continue to do that, but use the existing ones. They are definitely much better than just waiting for nothing. So with these kinds of recommendations from an individual perspective, vis-a-vis implementation perspective at a national level or at the state level, these two things do differ. But at the same time, certainly, if I can answer is both yes or no. We could have done earlier, but at the same time, a proper study, data, policy level discussions at the different level are also needed, definitely.
Right.
Shikha Tanwar, one of our viewers here, has a question for Dr. Reddy. Have the precautions changed for Omicron variant? Should we double mask?
Well, we know fully well that even the earlier transmission was both through droplets as well as aerosols. Now, this seems to have even better ability to spread through aerosols, and therefore, it is likely that double masking is going to be helpful. If you have a good N95 mask, yes, you're well protected. But if you're wearing a surgical mask or if you're wearing a cloth mask, it's better to be double masked because that is likely to be much more protective. If you have only one mask and can't get hold of a second mask, at least have a multi-folded face tissue paper as your second mask inside your main mask. That will also sometimes help your spectacles from stop it from getting fogged. But double masking is preferable and is likely to be more protective than a single mask.
Well, so double mask it is. Pranav Jha wants to know, when will India have its own new variant? I hope never, but the question is, I don't think Omicron would wreak havoc as much as the next indigenous variant of India will. How much time do we have for
You
that?
already have one.
We have Delta.
But
Delta
see,
is the one that is supposedly gone from India. So,
but the fact remains that this virus, which has come, with respect to whether South America or Europe, or South Africa, Europe, or whatever it is, now it is a part of our, it is circulating in our own body. So forget about it. It is no more a foreign vaccine, foreign virus. It is Indian one, definitely. And let us treat that this virus has all Indian characteristics.
Well, then on that note, Jaideep Pandey's question, what's your view on vaccine cocktail? You have answered it a bit, but for our viewers who have joined now, what's your view on that?
well, if you have adequate supplies of a wide range of vaccines, then whatever evidence is available suggests that heterologous mixture of vaccines is likely to have a stronger immune response than a homologous mixture of vaccines. So a vaccine cocktail would certainly be better if we do have adequate amount of each of the vaccines available. But in the absence of that kind of a wide supply chain, we should use whatever vaccines we have. And particularly if the protein vaccines that are now being given permission, if they become available in large quantities, they too can be very useful as additional booster doses. And they can provide a heterologous mixture as well.
And Abantika, this is something that I want to ask you because it involves education as well as health. Rajneesh Kumar wants to know, how long will it take for this Omicron situation to normalize? Is it impacting education sector drastically?
Impacted education, I think, and I mean, if education is not just classes and books, I think our children's social skills have completely gone for a toss. Also, I mean, I see a lot of games being played during classes and all of that. So I think education has already suffered. It's not about Omicron or Delta or anything. You know, the fact that they've been cooped up at home for days, even if they are doing online classes, I mean, if you ask me, the one casualty through these 2 years has been education, and 2 years is a lot of time for a school kid. So I think it's been a constant casualty, really.
Yeah, it's not just the schooling, it's the socialization.
Exactly.
That's absolutely critical, particularly for the younger children.
Exactly.
I have another question from Swanand. Wants to know, people keep saying less hospitalization is required, although not low, but data from US shows significant hospitalization. So given so many people are still not fully vaccinated, what should we expect?
Well, the likelihood of many people requiring hospitalization will be there if a very, very large number are infected in the first place. As has been repeatedly said, even a small fraction of a very large number will still amount to a large number of people requiring that kind of care. But of course, the situation is slightly different because we are a younger age than the United States. We also have less degree of comorbidities in the older age compared to the United States. So there may be some favorable conditions. But nevertheless, we cannot take the situation lightly. We have to recognize that the larger the rise in cases and faster the rise in cases, there will be a greater number of people requiring hospitalization. If the virus happens to be somewhat milder biologically, we should take advantage of that, but not be careless. At the moment, yes, we are seeing a very fast bowler, but the pitch conditions seem to be favoring us, but we should not be playing rash shots.
Dr. Salunke, another question for you. How much time the virus takes to kick in? Are there different symptoms for Omicron?
I don't think so. The symptoms are primarily, again, the combination of the upper respiratory tract, whether it is kind of a flu with the fever, all the classical symptoms of upper respiratory tract are demonstrated by Omicron. And that is the reason majority of the milder cases are even missed. And these, compared to the Delta, wherein the lower respiratory tract involvement or lungs involvement was one of the major factors which resulted into mortality, that seemed to be at this juncture not there. It's only primarily upper respiratory tract infection, but eventually we really, as the number grows, we do not know what is going to be a clinical picture, how it is going to get evolved. I have to just one point I wanted to just make as far as schools are concerned. I think if we were to compare economic adverse impact due to this pandemic and adverse impact on the education, I think more than the economic impact, adverse impact on education, primary, secondary, and college is worst. I think this nation is going to suffer heavily. 2 years of the life of a child or a college student being lost is a disastrous kind of a situation, and its implications and impact will be seen for decades or for at least few years afterwards. So I'm not much bothered about economic impact. रोजी रोटी थोड़ी कम हो गई कुछ दिनों के लिए तो ठीक है, लेकिन look at this kind of a situation that this younger generation is going to face. So I'm really more worried about that.
I have a question for Dr. Reddy. So what do you think of this decision to wait for 9 months from the second shot before the precautionary dose? Is there, evidence on this?
Well, we don't have very clear-cut evidence, particularly because we have not seen the nature of vaccines used in India have not been fully assessed from the point of view of the duration of protective effect. Part of it we have taken from UK-based evidence on AstraZeneca and extrapolated it to Covishield. But there too, we now know that after the third month, the immunity starts waning. And secondly, for Covaxin, again, we do not have a very clear-cut idea of when the immunity starts waning and when it disappears. But on the plus side, we are now seeing more evidence that even when the antibody levels fade, what we are seeing is that the cellular immunity still persists, the T-cell immunity.
Yeah.
But the real proof is in the number of breakthrough infections. See, whether we are talking about antibodies or whether we're talking about T-cell, we are only looking at markers. The real proof is in breakthrough infections. unless we have sound data which can link up our vaccination rates, vaccinated individuals, and the people with breakthrough infections, we cannot really say which vaccine has been protective for how long. So having said that, if we are still depending upon international data, we might as well take the recommendations there and say anytime after 6 months.
Do we
Shivan,
have data?
no,
Do we
go on.
have data on breakthrough infections in India, sir? Any sort of data?
Well, Dr. Salunke should be able to tell us that.
I don't think that we have a data to be very emphatic about this kind of a situation. It is all ranges. It is also dependent upon individual hospitals or some of the clinicians. But otherwise, I'm sure I can't say that I can speak on behalf of the government or I can speak on behalf of the technical bodies. But according to me, this type of data is neither there or it is not published. But hospital level data are available, and based on that, the projections are being made. But solid data to clearly come out with the indications that this is the percentage of the breakthrough, I don't think it's available.
I think the different components of the data systems were not linked up early enough. Now they're linking them up, I think. But in terms of the databases that maintain the list of who are vaccinated and revaccinated, as opposed to the people who were tested and found positive or negative, and the people who are hospitalized, I think they're all in different databases and they need a better integration to get this kind of data.
Shivan Sembal has a question for both Dr. Reddy and Dr. Salunke. He's asking, what do you have to say about the reported new variant IHU in France? How long until this corona is normalized?
I think WHO has come out with indicating that, well, let's not get more worried. Let us get more worried about the Omicron, which is already there on ground. And this one thing is absolutely true. Newer variants are bound to come because this is the nature of the virus. Number two, as far as we are concerned, in spite of the fact that dominant variant which is right now in India is still according to me is Delta and not the Omicron, and eventually Omicron is likely to replace it. But the combination of the persistence or presence of these two variants, and particularly in the patients who are immunocompromised, who are likely to harbor this on a longer duration, who knows, there could be a further variant. So occurrence of different variants, newer variants is bound to be there, but how and in what way they are going to have both transmission and virulence, that can't be anticipated at this stage.
Well, the variants arise by two different mechanisms. One is called antigenic drift, in which the genetic structure tends to vary over time, and particularly if evolutionary biology plays a role, as the number of susceptible people decrease for the virus to infect, it tends to increase its infectivity but reduce its virulence. There's a trade-off. And that may be the reason why we are seeing Omicron in the present form. But the second is also antigenic shift, in which the virus can start exchanging genetic material with a different type of virus. And that can sometimes be helpful when it grows milder, or sometimes can be dangerous if it actually acquires characteristics from a more dangerous virus and then fuses with its own genetic structure. So we'll have to wait and see. But we give an opportunity for mutants to develop, or variants to develop, when we allow the virus to remain in the body for a long time. And that's why people who are immunocompromised, the elderly, or who are likely to have repeated infections are the people who must be protected most. And the less opportunity we give the virus to spread fast and create a bumpy road for it to travel by wearing masks and not crowding in public places, we will actually be nudging the virus to become milder over time. And that's what we must do.
Well, I will end with this question, all of you, if you can answer. Devjit wants to know, when can we see the peak? So, Dr. Salunke.
I think it will be a very hazardous kind of a guess, but still I feel at least next 3 to 4 weeks, the upward trend is bound to be seen. This is because it is just, we have just started in this third wave. So it is bound to take at least 3-4 weeks. Whatever that we have seen in South Africa or Europe and what we are witnessing now in US, according to me, India need to wait at least 3 to 4 weeks.
Dr. Reddy.
Well, if we manage to stretch it out by behaving properly, not allowing large crowds, wearing masks, we may be able to see the peak in late January or early February. If we act very carelessly, the peak could come even earlier. Secondly, being a large country, I don't think we'll see a single peak. We'll see different peaks in different parts of the country. So we'll have to be prepared for a 2-month to 3-month haul and trying to control this variant across all of India.
And Abantika, what's your take on that?
I think we've heard the experts' take on this. I shouldn't have a take on this after Dr. Reddy and Dr. Salunke.
Well, thank you all of you for joining in and sharing such informative the information. We will be back tomorrow with a new set of experts. Till then, please mask up and take care.
Thank you.